How do Medicare Part D drug plans work? Do they come with an instruction manual, and should I bother to read it? We're going to look at this in just a moment. Hey, this is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. Okay, here is a prescription drug card, and here is a manual, which, as you can see, is actually kind of skimpy. The real manual can be mailed to you. The paper manual can be mailed to you, or you can access it online, which is probably preferable because things do change during the year. Here is your Medicare card, and here is your Medicare manual, which is like 122 pages. The curious thing is, most people will read, or at least attempt to read, their Medicare manual, and they'll get maybe a fourth of the way through it, if that, and they'll say, I don't understand this. Why don't I just call Bob and ask him to explain it to me? And that's what they do. And that's fine. That's what I'm here for. But on the drug plan, they don't bother to read the manual. They don't go online. And that's a big mistake. I'll tell you that right now. With original Medicare, there's no networks. You don't have to look for participating providers. You don't have to be concerned about penalties because you went out of network, because there's no network. So it's actually pretty simple. There aren't that many moving parts to it. Original Medicare and a supplement plan, you're out of pocket for 2020 for health care is $198 a year. Not too shabby. Certainly a lot better than Obamacare. Drug plans, on the other hand, are extremely complicated, and it almost requires an engineering degree and a law degree and who knows what else in order to understand it. But I've got a pretty good handle on it, and I'm always willing to answer questions that my clients have about their Medicare drug plan. But let's start with a couple of things. When you go on Medicare and you pick up a Part D drug plan, you're suddenly faced with something that you may not have been aware of before, or maybe not even had to deal with, and that's called participating pharmacies or preferred pharmacies. What you will find is that all the drug plans have a preferred pharmacy list, and if your pharmacy's name is on that list, well, great. If it's not, that means that if you don't pay attention and fill your prescription somewhere else, you're going to end up paying a lot more. I ran a report yesterday for a new client, and the differences are amazing. And I'm going to read this to you. I took the two lowest cost plans, one of them, now total cost, I'm looking at premium plus copays, which is the only way that you need to evaluate a drug plan. Premium on one is $14 a month, on the other one is $21 a month. However, that's where the similarities stop. This particular individual only is on 4 medications. However, one of them is on very few formularies, very few at all. And the $14 plan actually has all 4 medications on their drug plan formulary. The $21 plan only has 3 of their medications on there. All right, let's break this down a little bit more. If they use their preferred pharmacy, if they go with the lower premium plan, the $14 plan, which has all 4 of their medications on their formulary, and they fill at their preferred pharmacy, which unfortunately is not the same. It's not a preferred pharmacy for that particular carrier. Their annual cost for drug copays plus premiums will be $5,400. That's a lot of change right there. If they're willing to change to a preferred pharmacy, which happens to be CVS, and CVS is loved by just about all of the drug plans out there, but if they change over to CVS, then their out-of-pocket cost dropped to $1,700. Still a chunk of change, but a heck of a lot less than $5,400. On the other hand, and this is just for comparison purposes and to kind of issue a wake-up call, if they went with the $21 plan and only 3 of their drugs are covered under the formulary, the other one is not, they can use their preferred pharmacy, and the cost of their medications is $3,600. Or they can go, and because that is a preferred pharmacy for that particular plan. They can also go to CVS, which is also a preferred pharmacy for that plan, and their costs are still $3,600. So $3,600 to have 3 of the 4 drugs covered with their preferred pharmacy and that carrier's preferred pharmacy, versus $1,700 for a lower premium plan that covers all of their medications but only gives you the best cost if you use a pharmacy that they're not currently using, but they're willing to use in order to save some money. So this basically kind of points out this is why you need to understand your drug plan. And one of the other things is on the drug plan manual, at least the one that I've got, says, if you read there, if you look through there, you can find out how to get your Tier 1 medications for a 0 copay. No money at all. So, there's some real goodies in the prescription drug plan manual that you may not know about because you never bothered to read it and you didn't ask me. Although when we're talking about your drug plan, I always point out that you can save money by using preferred pharmacies. Yes, you can use your card anywhere you want to. It just depends, like in the case I just told you, do you want to pay $5,400 or would you rather pay $1,700? So that's the story for the day. This is Bob Vineyard with the Georgia Medicare Minute. You take care. Have a great day.